Member for Burnaby North.
Thank you, Mr. Speaker. I rise to speak to my motion. Be it resolved that this House agree that the health of British Columbians is paramount during this pandemic and part of our economic recovery and resilience. One would be forgiven for thinking that such a motion states the obvious. But it was in this very chamber that the Leader of the Opposition rose to state, "We hear the Premier talking consistently about public health measures which actually don't have anything to do with economic recovery." Hard to believe, but that's what he said. This morning, we on this side of the House will endeavour to explain to him and his colleagues how public health and economic recovery are inextricably linked. Let me start by recalling the exchange that took place Monday, June 22nd during question period. The Premier stated, "In order to build confidence for consumers to go back into retail, into hospitality and other sectors that require that type of activity, we're going to have to do a couple of things. We're going to have to make sure that the workplace is safe. WorkSafe BC has been working with the public health officers to make sure that we put in place guidelines so that customers can be comfortable when they go into an establishment that they're going to be safe and the workers in there are safe as well." And the Leader of the Opposition dismissed that as having nothing to do with economic recovery. Now, Mr. Speaker, that's a curious thing to hear from the Leader of the self-styled Free Enterprise Party. Isn't his the party that believes supply and demand should drive the economy? Yet he doesn't seem to be making the connection that without consumer confidence, there is no demand. And right now, consumer confidence is all about feeling safe. Every day, British Columbians see the evidence on their screens of what can happen when consuming is ranked to be more important than health. In May, American states were already getting ready to reopen their economies. Their president was pressuring them to move quickly. He told the American people, and I quote, "You have to get back to work." By early June, he was praising Florida specifically. He said, "They are doing tremendous business, and this is what the numbers are all about." By July, the numbers were about something else. Last Thursday, the U.S. reported a record number of new cases in one day, and so did Florida. The number of hospitalizations are up steeply, and the COVID-19 death rate is starting to climb again. British Columbians can't help but be worried by the news south of the border. Many of us continue to think twice about going out for a meal, booking a holiday, meeting friends in a bar, getting a pedicure, or all the other purchases we would be making this summer. Not a day goes by when that agony of indecision doesn't come up in idle conversation. And here's another topic that comes up every day: how thankful we are to be living in British Columbia. Here, we flattened the curve. How? Because we are fortunate enough to have an independent public health officer who has extensive experience and expertise in pandemics. Dr. Henry has taken a thoughtful, evidence-based approach, and British Columbians trust her and are willing to follow her guidelines and orders. And because our government has chosen not to compete with her for attention, has chosen not to politicize a global health crisis. We know that it's not our job to make medical decisions, but to make decisions about the services and supports people need in order to keep each other safe. We have reason to expect that the members on the other side are going to try to make this debate about taxes. Cutting taxes seems to be their knee-jerk answer to everything. Let's not forget that it was their tax cuts that concentrated our shared wealth in the hands of the few, that drained the public coffers, which led to regulatory bodies like Employment Standards Branch being defunded and public services like long-term care facilities being privatized. There is a direct line between the decisions made by the previous government and some of the COVID-19 outbreaks that ended up shutting down our economy. Right now, more than ever, British Columbians need to trust that both their health and their livelihoods are in good hands, and that starts by understanding the connection between the two. And with that, Mr. Speaker, I will take my seat and turn the floor over to others to elaborate further. Thank you.